Hello again. So this is actually, I think I miscalculated yesterday, and I think yesterday was day 5 and today's day 6. Last night wasn't a great night, but I've had some requests to share more, and there are some things that I think are would be warranted to share. So first, while I'm still having them, because I don't know if they'll go away soon or not, something, if you don't take medications normally, and or if you've never had um, breathing treatments, something that you can expect is afterward you feel a lot of, and this is something as a nurse I already knew and I would tell all my patients, but it is different when you're experiencing it yourself. You feel very anxious, jittery, you'll get shaky. um, it's ridiculous. You feel completely out of control. Your dexterity will potentially be affected. Um, and that, unfortunately, is an expected side effects, an expected side effects, an expected side effect of breathing treatments. So um, don't be scared. It's an annoying side effect, and a necessary evil to do good things for your lungs. I just finished my breathing treatment, and I hate this feeling. But like I said, it's a necessary evil. You have to take certain things, you have to do certain things to help your body get through it, even though it doesn't feel great. Um, um, Something else to keep in mind, I'm not going to physically do it because I can't hold the phone and do it, but something to keep in mind after a breathing treatment, you should always, um, if you, at the very least, if you don't clean the equipment, at least put everything inside of a Ziploc so that things don't end up on the floor and everything. You don't want to introduce more crap into your body when you're already trying to take in a medication into your lungs. You certainly don't want the tubing, the mouthpiece, the face mask. You don't want those things on the floor. What I would recommend is to rinse it off and to let them air dry in a clean area, not by the toilet. Um, I'm using the kitchen. Um, so after I'm done with this video, I'm going to go rinse the things out, let them air dry, and then once they're dry, I will make sure that the tubing is and the equipment is all bagged up appropriately. You don't have to disconnect everything from the machine. Just the mouthpiece and the reservoir um, uh, from the actual tubing, and the two ways that you know when your breathing treatment is done is when you're doing the breathing treatment, you'll notice this white fog that comes out of the machine as you're exhaling. Um, Not the machine, the mouthpiece. Geez Louise. Like out of that part right there. And then um, if you have on a mask, it'll, all of the masks have two holes in them. They're supposed to. Um, but I encourage you to breathe as slowly and as deeply as you can while doing your breathing treatments. Sorry. Um, that will get the medicine further down into your lungs. Make sure that when you're loading your breathing treatment, that all of the fluid is gone. You twist that part off and you put it directly down into the reservoir. Um, you should try not to touch the two. So again, there's no contamination, but again, this is not a sterile process, but try to keep it as clean as possible. So then you make sure to empty all of the medication out. I'm excuse me. I'm on albuterol sulfate. Other people may be on other things. Other people may be on a combination of things, and you should always follow the instructions that you're given by the pharmacist. That's another thing that I've learned. If you have to end up taking these medications long term, and you can't afford the medications at the cost that they are with the insurance that you have, the person to go to is not your doctor. A lot of the time, they can give you maybe free samples or coupons to help with that, but that's just temporary. It's not a bad thing to try, but if it's not a new medication and it just starts to be too expensive, or if it is new medication, regardless, when you pick it up from the pharmacy, ask the pharmacist exactly what you can do to investigate a medication cost that is easier for you to cover. They can give you the names and numbers of foundations associated or affiliated with each particular medication that you're taking. And this is not just for respiratory medications. If you're taking a cardiac medication, a diabetic medication, ask the pharmacist for either patient assistant programs through insurance or through the medication itself. And that would be a good place to start. That's going to be all for this video. And yeah. Hope you have a wonderful day. I'm going to take the rest of my medicine.